I'm here to talk to you about the latest health report. Today we're here to talk about hospital-acquired venous thromboembolisms, also known as VTEs. A VTE is the formation of a blood clot in the vein. When a clot forms in a deep vein, usually in the leg, it's called a deep vein thrombus, or DVT. If that clot breaks loose and travels to the lungs, then it's called a pulmonary embolism, a PE, which is a life-threatening disease. VTEs affect nearly 9,000 Americans each year, and 3 in 10 people who have had a VTE will have another episode within 10 years. Additionally, 1/2 of these clots occur during or soon after hospital surgery or stay. However, by implementing nursing implications, VTEs are often preventable with prophylactic treatment and care. Here's Elizabeth on scene at Bellarmine University to talk more to us about preventions and interventions.
One of the most effective interventions in preventing VTEs is patient teaching. A study by Gasson from the Joanna Briggs Institute of Evidence-Based Practice database reveals statistical significance suggesting patient teaching on signs and symptoms of VTEs decrease the number of VTEs within the hospital. Likewise, this patient teaching should not occur on admission but should be repeated and continuous throughout the patient's stay. Additionally, Duffin from the National Guidelines Clearinghouse suggested that it is the nurse's responsibility to assess and recognize signs and symptoms of VTEs, in addition to acknowledging contraindications such as oral contraceptives. A nurse should properly assess each patient and determine signs and symptoms prior to further complications of VTEs. Assessing a patient for VTEs would include any pain or tenderness in the extremities or an increase in the size of the extremities of your patient. Warmth is an indicator as well as a positive Hohmann sign. If the patient reports no pain, this would be a negative Hohmann's result. But if the patient reports pain when the foot is flexed towards the head, this would be considered a positive Hohmann's result, at which time the physician needs to be called immediately. Another intervention in preventing hospital-acquired VTEs is to encourage ambulation to promote venous blood flow. However, if it is not safe for your patient to ambulate, then promote active or passive range of motion of the legs and feet every 1 to 2 hours. Additionally, a patient can restrict positions that restrict blood flow, such as having a pillow under the legs that can result in a blood clot. The nurse can also consult the physician about the use of TED-HOS or SCDs. A study by Barrera from the Cochrane Database of Systematic Reviews found statistical evidence suggesting external mechanical devices such as graded compression devices or intermittent pneumatic compression prevent DVTs. Finally, it is a nurse's obligation to administer chemical prophylaxis such as low molecular weight heparins or other anticoagulants in a timely manner if ordered by the physician. However, a nursing intervention, the nurse needs to prioritize these patients as it could be a life-threatening situation. With these interventions, we could cut hospital-acquired VTEs by 70%. That's all we have today. So it's back to Brianna.
Thank you, Elizabeth. Well, what isn't known about VTEs is they can cost our hospital money. Treatment can cost as much as $15,000 to $20,000 per person and can cost around $10 billion a year at our hospitals. Why not implement these nursing interventions and use that money to send our healthcare professionals to the beach? That's all we have for today. Thanks for listening.